On with the lesson. Imagine that you've gone to the movies, right? And there's 100 people in the cinema. One person sneezes. The risk of sneezing in that time period is 1 over 100, right? The number of people that had the health outcome, in this case sneezing, over the number of people at risk at the beginning, which is 100. So it's 1 over 100. That's the risk of sneezing. The odds of sneezing is slightly different, right? Now it's 1, that's the numerator, the number of people that had this health outcome, divided by the number of people who didn't have the health outcome. Not the number of people at risk at the beginning, but the number of people who didn't have that outcome. In this case, it's 99, okay, because 99 people didn't sneeze. So you might say to yourself, look, the risk of sneezing and the odds of sneezing in that movie are very, very similar. And that's true. When you're talking about risk and odds at low incidence, they are very similar, almost indistinguishable. Where this becomes more apparent, the difference between them, is when the incidence is higher. So let's change the scenario slightly. Let's imagine that 55 people in this movie sneezed during the time of the film, right? Now, the risk of sneezing is 55 over 100. So 55, the number of people who sneezed, divided by 100, the number of people at risk of sneezing at the beginning of the movie. So 55%. The odds of sneezing, however, are 55 over 45. Right? 55, the number of people who sneezed, 45, the number of people who didn't sneeze, right? And that's 1.2. Now, we said about odds, if the odds are more than 1, then it's more likely that you sneezed than you didn't. And that's true in this case. The odds are 1.2. So it's for any person going to that cinema for that period of time, it's more likely that they would have sneezed than they wouldn't have. Now, stay and watch another video. The next video that I want you to watch is a video that's going to be on understanding the difference between a case control and a cohort study. Thanks for tuning into the Global Health YouTube channel. Please subscribe if you haven't before. Hit the bell notification so you get notification of future videos. I really enjoy feedback, so put comments in the comment section below. Stay well, don't do drugs, always do your best. Speak to you soon. Bye.